Hello there. Thank you for joining me. This is a little refresh for the back. This is a gentle version, but I've also posted a more active version, and I'll pop a card up here so that you can find that if you want that. These also work together. If you do both of them at once, just make sure you do the active one first and the gentle one second. Grab a yoga block or something like that, and a belt. A scarf also works, or maybe even a towel you could use. Okay, so just have those nearby, next to you somewhere, and stay in your seat and just check that you have your head back, over your lungs, over your pelvis. It tends to want to go forward, especially if you work on a computer. Just give yourself a chance to settle in and to feel the weight of your hips down on the ground. Then interlace your fingers and spin your palms forward. Straighten your elbows if you can. I'm just going to turn sideways so you get the whole spinal view now. Then you're going to draw your waist and belly back and push your palms farther forward. So you're rounding your back now. Let your head drop so that it's looking down. Your eyes are looking down. Imagine that you could spread your shoulder blades apart. Begin to roll yourself to more upright. The arms start to come overhead, and as they rise, if you find that you get impingement in your shoulders, your wrists, or you start to have discomfort, just stop. So we're not necessarily trying to go to any particular height. We're just trying to get the arms in the direction of going overhead. Free your hands, go palms forward, shoulder width or a little wider. As you exhale, bend your elbows so they're like goalposts at 2 right angles, but push them back a little bit so your chest opens and your shoulder blades engage on your back. Then inhale the arms overhead and exhale the arms down. If you're sitting cross-legged, look at which leg is on top or in front. We're going to switch that in a moment, but for now, we're going to uncross the legs, or if they're already uncrossed, straighten them and widen them about as wide as your mat or outer shoulder width apart. Take your hands behind your hips and turn your hands out so the fingers are pointing away from one another. Then roll your shoulders back, slide your head back, and lift your chest up. So just try to get your low back to go in and up and the whole rest of the spine to kind of follow. Meanwhile, squeeze your knees to straight and press down with your legs. Relax that effort, cross your legs again, and go your second favorite way, the opposite one in front, or whatever way you're sitting that isn't cross-legged also works. Just repeating now, we're going to interlace the fingers, we're going to push the palms forward, and then we're going to draw the spine into a flexed or rounded shape. So you really want to try to get that middle to low part of your back to flex. Oftentimes we flex above it or below it, so the whole spine is involved here. Then roll your chest up. Again, arms going in the direction of overhead, but stopping if you start to feel any gripping in your throat, any constriction in your breath, any pain in your shoulders, or anything distressing. Unclasp the fingers, but arms stay overhead. They go a little wider than your shoulders, palms toward the front. Exhale, draw the elbows back, open the chest. Inhale, reach the arms overhead. Exhale, release the hands. And once more, stretch the legs out if they're not. This time, you're going to lean back onto your elbows. So you're going to put your elbows down, something like underneath your shoulders, press down with your hands and forearms, and do similar action to what you did last time, which is to say, roll your shoulders back, puff your chest up, and drop the head to a distance where your neck, you might feel your neck working a little bit, but you're not like dumping your head back. Oh, that hurt my neck. So don't do that way. curling the whole spine and keeping the head as a part of that curl, not just bending at the neck. Then relax that effort, and then lie on your back. You should have your block and your belt nearby, so that once you lie down, you don't have to get up again to go get them. So you're gonna rest your spine on the earth, and then you're gonna pull your right knee toward your chest, and you're gonna aim it so that you don't have any pain or anything weird happening in your right hip. So it might be a little wide, might be narrow. Just pull it in, let your back round slightly and release toward the floor. This is where you're going to grab your belt, your scarf, your whatever you have, strap, sling. Slip the belt, sling, belt, whatever you have over the ball of your right foot, and then aim your foot straight up above your pelvis. Begin to grow the leg in the direction of straight, but not so straight that your butt or low back start to lift off the floor or grip in any way. And just be patient. The back of the leg stretching. Try to just stay present and give some time for this leg to acclimate to the sensation of stretching that's happening right now. Okay, you're going to take the belt in your left hand. Keep your hips level and pull your leg just ever so slightly across to the left, like maybe 6 inches. As it goes to the left, you can take your left knee and kind of drop it to the right. I know that's a little bit weird. It's like pigeon-toed. It's almost like you're going to cross your legs, and that's going to help you not tip over. So we're aiming to stretch the outside of the right hip. You might feel it in your IT band or in your sacroiliac area. So staying with the foot roughly in the alignment of above your pelvis. It's now to the left of the right hip joint. And relaxing the low back as much as possible. When you exhale, open your mouth and just give it a long, slow sigh. After which, you're going to release that leg, place your ankle on your knee, and let your right knee open away from your belly. You can use your right hand too to kind of push the right thigh away from your head if that feels good. In either case, we'll come on out of that, put the right foot down on the floor and just pause in the middle. And then take your left knee toward your chest. Bring it to your hands and aim it where it needs to go so it feels good in your body. You're allowing your low back to slightly round and to relax toward the floor. It's not being too rigid with form. Just having some compassion for the suffering of the body. The body has moments of pain and suffering. And so we're not trying to enforce something rigid or strenuous. The body suffered enough. I'm just trying to work with where we are. Find your prop again. Place the ball of your left foot in it. Head in the direction of foot above pelvis, heading towards straight, but it doesn't have to be straight. It's more important that you allow the weight of your hips to be really grounded and your low back to be really kind of soft toward the floor. If it starts to clench and resist, then we're just contributing to the suffering. So there's a difference between strengthening and clenching. We want the strength if we're working these muscles, not clenching. So soften your front, soften your solar plexus, soften your belly, just let it relax so that the hips and the spine can be kind of heavier toward the floor. And over time, you might find that that left leg gets straighter. Maybe it doesn't. That's not necessarily the goal. We are stretching the leg, but it does not need to be extreme. The effort does not need to be extreme. 20 to 30% effort is all you need. Even if the intensity of the stretch is higher than 20 to 30%, your effort to be there should not be high. So let's place the belt just in the right hand now. Now remember that we're keeping the hips on the ground. We're not twisting here. We're simply moving the foot across or to the midline. As you draw the foot over to the right, you might find it helpful to turn your right knee in a little bit. So the knees, it's almost like you're crossing your knees. They're not touching probably, but and that right foot can kind of help you not tip over, to not twist. Just make sure that outer left side of your pelvis is down. And if you are feeling a strong sense of stretch, just be observant of that. You don't need to do anything with it. Just stay with it. Just be present. Be patient. Compassion for what your body has experienced, how it has reacted, and I'm not meaning that as a negative term, what it's done to survive. Full sigh out the mouth. And you're going to bend that knee and place your ankle on the right leg. Take the belt off, just put it to the side. And let your left knee kind of fall away from your head. You can also use your left hand to kind of press your thigh away. That might make your hip shift in a little bit of asymmetry. That's totally fine. And then you're going to release. Let's put your foot flat. Grab your block. Let's do either the low or the medium height here, not the highest way. Lift your hips and place the block under your sacrum. Your low back is not where you want the block. You want it under your pelvis. And I'm going to give you a couple options here. Obviously, one is to just be here. This is a legitimate pose, posture, stretch. It's going to be slightly restorative because the head is lower than the heart. So you could stay kind of just doing nothing here. Or you have some other options like maybe stretching one or both legs out with your feet on the floor. Sort of opening the front of the body. That usually gets really short when we sit a lot, and that can contribute to back pain. You could also, if you feel stable on your block, you could also pick up your feet, just hover the feet with the knees bent, or take the feet up in the air. So it should stay on the relaxing side. Don't get too effortful or carried away so it causes you to sweat or huff and puff. Let's take a couple more breaths doing whatever you're doing. And if your feet are up, you're going to bring your feet down. Just push your feet down. Squeeze your butt muscles. Lift up off of the brick. Slide the brick out. Roll down through your spine. Just windshield wiper your legs from side to side so that the pelvis turns as the knees move. Stopping anywhere along that plane of movement that feels really good. Typically one end or the other might call to you. And then just pause, symmetrical, so maybe with the knees bent, maybe the legs straight, with the hands either out on the floor or somewhere on your body. And an acknowledgement of what your body goes through in a day. So much. So now we're just going to sip in some breath. Sip in a little more. Sip in a little more. Hold it full, hold it, hold it, hold it. And now out the mouth. Start to blink your eyes open. Crack your knuckles, roll your feet, roll your hands, roll your head, whatever you want to do to reawaken. When you're ready to move, you can roll to your side or whatever feels good to you. And just go slow. Push on up to sitting. Just pause long enough that you kind of regroup. You kind of land back in your body before you move off into the rest of your day. I really appreciate you being here, and I look forward to next time. Until then.